Hi, my name's Dr. Jeff Williams, Director of the Invasive Cardiac Electrophysiology and Heart Rhythm Center of the Good Samaritan Hospital and Lebanon Cardiology Associates. This is Lecture 4, Preoperative Workup and Evaluation, and Meeting the Implanting Physician. The objective of this lecture is to be able to describe the elements involved in preparing a patient for pacemaker implant surgery. The first important element of the evaluation for a pacemaker is the type of doctor who will be performing the pacemaker implantation. All doctors have years of training built upon a foundation of patient evaluation that permits a thorough, yet concise summary of a patient, his or her symptoms, medical history, and differential diagnosis. A cardiologist is an internal medicine doctor whose training involves 4 years of undergraduate college, 4 years of medical school, 3 years of internal medicine residency, and 3 years of cardiology fellowship. An electrophysiologist is a further subspecialized cardiologist who performs heart rhythm evaluations and electrophysiology device implants, such as pacemakers and defibrillators. Typical training involves the same training as a cardiologist, plus an additional 2 years of electrophysiology or heart rhythm fellowship. During this electrophysiology fellowship, an EP focuses exclusively on pacemaker and defibrillator implantation, long-term care of these devices, and other heart rhythm evaluations. General and heart surgeons can often implant pacemakers, and some can even implant defibrillators. There are several questions to ask your doctor before surgery. The first is, what is your training background? Board certification in electrophysiology may reduce complication rates. How many pacemaker implantations have you performed? Doctors who perform more implants seem to have fewer complications. What have your complications been? This question can be especially enlightening because it will give you an idea if this doctor has looked at his or her outcomes. A doctor who tells you that he or she has no complications is misinformed or has not done enough procedures. Any doctor that performs procedure has complications, and a doctor that cares about patient outcomes will have done due diligence to minimize complications from happening again. That being said, there is generally no way to have zero complications, but it is important to choose a doctor that has in-depth knowledge of the possible complications. What type of pacemaker will be implanted and why? A rule of thumb is that more complex devices, dual chamber versus single chamber pacemakers, for example, have been associated with higher rates of complications. However, there is also data that does not demonstrate increased rates of complications in dual chamber devices. It is important to discuss what type of pacemaker will be implanted with the doctor. Elements of the doctor's evaluation. The first item the doctor will address is the history of present illness. This is the signs and symptoms of the current medical illness that may require pacemaker implantation. The past medical and surgical history helps to risk stratify patients and includes information about such things like prior heart attacks, congestive heart failure, or arrhythmias like ventricular tachycardia or fibrillation and atrial fibrillation. These all may suggest the presence of underlying heart disease and possibly higher rates of conduction system disease. The social history is used to obtain details about a person's life that are not purely medical, such as personal habits like tobacco, alcohol, and illicit drug use. Allergies are especially important, and your doctor should be aware of any drug allergy or prior concerning reaction to any medication. The family history is important, and the saying "an apple does not fall far from the tree" is used to emphasize the importance of family history. Things such as sudden, unexpected cardiac death or early heart attacks are especially useful historical elements. Finally, the physical exam, including vital signs such as heart rate, blood pressure, respiratory rate, pulse oximetry, and overall weight, are important to obtain. There are some studies your doctor may perform in order to prepare you for pacemaker implantation. A chest X-ray is used to ensure the heart and lungs are in suitable condition for the implant. An electrocardiogram, also called EKG or ECG, is used to evaluate for any electrical system blockages or old heart attacks. An echocardiogram is used to evaluate for heart failure or valve disease. And baseline blood laboratories are used to evaluate for kidney function, blood counts, and blood coagulation studies. There are some other issues involved in preparation for pacemaker implantation. Preoperative risk assessment is the most important, and it is used to make sure the benefits of pacemaker implantation outweigh the risks. The risk of infection. Patients that have an ongoing infection are at risk of pacemaker infection, and this is an especially catastrophic event. Use of contrast agents during pacemaker implantation. A patient may have had a prior allergic reaction or experience kidney dysfunction during prior use of contrast agents. You should let your doctor know ahead of time if you are allergic to any of these agents. Finally, thyroid issues. Both overactive, called hyperthyroid, and underactive, called hypothyroid, can delay pacemaker implantation surgery. Want to learn more? What is a Pacemaker? A Cardiologist Guide for Patients and Care Providers is available in print and electronic versions at Amazon.com, and you can see more lectures at heart-rhythm-center.com. Thanks for listening.